parent affiliates or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Happy Thursday, everyone. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency operating in Dade, Broward, and Palm Beach County. For more information, you can reach them at 954-717-7027. I am your host, Dawn Graubert, or info@allcountyhealthcare.com. Tonight we have a special treat for you. We have Dr. Amy Seinfeld joining us. We're excited to have her. She is a board-certified family medicine physician, an osteopathic doctor with over 28 years of experience in comprehensive patient-centered care. A graduate of Nova Southeastern University College of Osteopathic Medicine, she has dedicated her career to helping patients achieve long-term wellness through both traditional medicine and a holistic approach. Dr. Seinfeld treats patients of all ages and brings expertise in treating hypertension and high blood pressure, bronchitis, diabetes, and a wide range of chronic conditions. She also focuses on hormone health for both men and women, supporting optimal health, balance, and overall well-being. Her philosophy goes beyond symptoms. She looks at the whole person, incorporating lifestyle, environment, and preventive care into every treatment plan. Dr. Seinfeld joins us to share insights on proactive health, prevention, and how we can take control of our well-being in a meaningful and sustainable way. You can reach her at Dr. Seinfeld, SEINFELD.com for more information. Welcome, Dr. Amy Seinfeld.
Welcome, and thank you for having me here.
It is such a pleasure.
Great
Tell
to be
us
here.
About your practice, family medicine. What does it incorporate?
So family medicine really incorporates following people throughout the different life stages. And the beauty of that is you can see people, from infancy, childhood, adolescence, when they get married, when they start having kids, growing their own family, and then also geriatrics as well. So at some point in my career, I'm actually seeing 3, sometimes even 4 generations of people. So that's what makes it really interesting.
What brought you into the field?
Well, I guess the influence of my father and grandfather, and just being around, medical people growing up, and also my interest in health, wellness, and longevity. I was always, even as a teenager, into just exercising, living healthy, eating healthy, and so that's why medicine really interested me.
And you're a doctor of osteopathy, osteopathic medicine. Explain to our listeners how that's different than a medical doctor. It's medical, but it's different training. You look more at a holistic approach?
So, and that's correct. There's 2 different schools. There's an allopathic school, which is an MD degree, and an osteopathic school, which is a DO degree, or Doctor of Osteopathy. And the difference is the training is the same in terms of, you take the anatomy, the histology, the biochemistry, and you do your rotations. But within the osteopathic curriculum, you learn more about the musculoskeletal system and the interaction of how the spine and the whole musculoskeletal system affects the entire body and the organs. So like you said, a holistic approach. You don't just look at one part of the body, but the integration of all the different systems in the body.
Which kind of leads me to the next question. Let's talk about hormones. Hormones are not just, like I laugh when we talk about menopause and andropause. Hormones actually regulate our entire body. How does that fit with family practice?
So in family medicine, you're following a woman or a man throughout life, and as they age, get into their 40s, 50s, and thereafter, the levels of hormones change. So that's going to affect a lot of things. It's going to affect metabolism, fat distribution, bone health, heart health, brain health. So it's important to be able to recognize that and be able to address that as a patient is aging throughout life.
All right, so fatigue, weight gain, bloating, inflammation. I mean, the list goes on and on. It's not just sexual function like people think about, or losing your cycle for women, or hot flashes. There's a lot more that goes into it. Even thyroid support. Thyroid, right, is our major hormone regulator.
Yes, thyroid is the gland that sits here at the base of the neck, and it does secrete a hormone that's a major plays a part in regulation of metabolism, sleep, wake cycle, skin, hair, nails, everything. So hormones like the thyroid hormone, and also female hormones, estradiol or testosterone, which is in male and females, those are all what we call chemical messengers or regulators. So they're all involved in the health and wellness. And as we age, when our body stops making them, it's helpful to replenish them.
And you got very interested in your residency and your training on
That's
hormones.
right.
So you've really
That's right.
specialized a lot in hormone replacement, the science of hormones.
Yes, that's correct. I actually did my research on hormone replacement therapy in females. This was many eons ago, back in 2001. And unfortunately, right after I graduated, the WHI, or Women's Health Initiative, came out with data not supporting hormone therapy. And we now know that that data was incorrect. And it took 25 years to happen, but we're now recognizing the benefits of hormone replacement therapy for both male and females.
And what have you found now that this just changed, I want to say less than a year ago, right? It was like July of 25 that we suddenly
correct.
said, oh, wait, maybe we were wrong.
That's correct.
So I feel like a whole generation of my mother's generation lost the benefits because there was so much fear of people stepping into the hormone realm, which then leads into our generation, men and women, because it's not just women that need hormone supplements, men need it as well.
Absolutely, 1,000%. So, and you're correct, July 16th, 2025, there was a large roundtable discussion where the FDA gathered the experts in the field, and they removed the black box warning from hormones, which was huge. And we now recognize that hormones can be started 10 years prior to menopause. That menopause is just not a sudden event. It's a gradual change that occurs over time. And the same with androgen or andropause, when men lose testosterone. It's a gradual decline over time.
And how do you look at it? And I know people are listening, and this is all county healthcare, so you're thinking maybe it's people that are more homebound, or people that are in the 70s and 80s, and they're thinking, oh, I don't need hormone replacement, or is it too late for hormone replacement?
So in my book, it's never too late. I like to evaluate every person or patient individually and assess their needs. And it's now, there's data out there by the Menopause Society and other places that recognize hormones can be taken through their 80s. Now again, it has to be monitored by a physician, because especially with testosterone, there are risks of blood clots.
Through their 80s?
Yes, through their 80s. Well, think about it.
I mean, that's amazing, because I think I have so many friends that have been stopped, or a generation like my mom, or your mom, right, who said maybe they were never on it. Can they start in their 70s or 80s?
And that is correct. The Menopause Society recognizes that low doses can be continued for women well into their 80s. Of course, monitored by a physician.
All right, so let's talk about bone health, osteoporosis. We talked hormone regulation can help with osteoporosis. I know weight-bearing exercises, movement, and all of those things. But can replacement of, I guess, testosterone for men, estrogen for women really help?
So there is a basis, and it's a whole chemical process of how estrogen helps calcium move into the bone properly. So again, it's like a recipe. When you cook and you have a recipe, it's many ingredients. So it's the calcium, it's the vitamin D, it's the weight-bearing exercise, because we want to retain muscle. And it's also the estrogen or estradiol that's pushing the calcium and the vitamin D into the bone where it needs to be to create stability.
What are you finding with other medications as we age, right? We've got cardiovascular meds, we've got osteoporosis meds, we've got
Yes.
High blood pressure medications, the list can go on and on. How can we balance hormone replacement and these medications? Because if something's depleting our bone density, can we add something to help it? Or are we just chasing the wheel?
Absolutely. There are many medications out there that can help with osteoporosis. Some of them also have side effects. So we have to be monitored. There's a daily pill, there's also a weekly pill, there's infusions, but again, a lot of them have side effects. So if you're going to start with the basics of just replacing a hormone, which your body used to make and can no longer make, that's the basic and will probably most likely have the least amount of side effects.
All right, so let's talk synthetic versus bioidentical. So if we're replacing the hormones that we've lost that are really true to our human anatomy, that would be more of a bioidentical versus a synthetic?
Correct. So my training has been using I've used both throughout my career. Of course, oral contraceptives are synthetic, but bioidentical means that the chemical structure of the hormone is compounded and it's the same chemical structure your body used to make. So all we're doing is replacing what our body can't make anymore.
But what is that made from?
So it comes from yam and also something called fenugreek. So it's a natural source, and they take something out called dysgenin or biasgenin? Diasgenin is the name, but they take an ingredient out and they take it, so it's plant derived, and they take that ingredient and they make the same chemical structure of estradiol of what your body used to make.
And what I love about your practice is you look at the blood levels of your patients. So someone comes to you, don't just say, all right, based on your age and your weight, you're going to have this dosing. You do blood work.
We do blood work.
And you do an intake.
Yes, we do blood work because with a male, you're going to have a decrease in the testosterone level, and there's free and total testosterone. And with a female, you're going to have that shift. There's actually 3 estrogens your body makes. One of them we don't pay much attention to, but when you're young, your estradiol is low and your estradiol is high, your estriol is low, and as we age, that shifts. So we want to get blood work and see, where is that shift? Where are you at?
And then we're looking at, when I get my labs, right, there's the green. So green to me is good. There's a normal range, but my normal range and your normal range, it may say we're all normal, but you may operate at a different optimal level than I do, even though we're both in this green that we look at on our lab results.
That's correct.
So what do you look at for that?
So I look at a number of things. I look at the clinical symptoms that the patient's having, because I don't want to treat a lab value or a number. I want to treat how the patient feels as well. So clinical symptoms are important, lifestyle is important, as well as what other medications they're taking and what other chronic diseases they have.
All right, so on the other side of this commercial break, we're going to come back. We're going to talk about clinical symptoms. What are some of the red flags that you may be feeling even before you hit menopause or when you think you're well after menopause or andropause? Things that you're going to look at on the other side with Dr. Amy Seinfeld. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. They are a Medicare certified home health care agency operating in Dade, Broward, and Palm Beach County. For more information, you can find them at info@allcountyhealthcare.com or 954-717-7027. Tonight we are here with Dr. Amy Seinfeld. She is a family medicine practitioner looking at the holistic gestalt, as they say, of the human body, hormones, chronic disease, and everything in between. So welcome back, Dr. Amy.
Thank you, and thank you for having me.
So before commercial break, we were talking about the clinical symptoms that we're looking at. What would people say? They wouldn't even think that maybe they need hormone replacements because it had really been taken off the conversation for so many years. What symptoms do patients come to you and you go, red flag?
So many symptoms, a multitude. Hot flashes, fatigue, night sweats, loss of libido, dry skin, dry hair, nails cracking. Then there's the mental health, depression, mood irritability, vaginal dryness, hair loss, inability to retain muscle. That's a huge one. And sometimes people don't even correlate these symptoms with lack of hormones.
Because they're and even I know heart palpitations are something with thyroid disease. There's so many symptoms that you'll run to the cardiologist, but it could be a change in hormone levels.
That's right. It could be something that your family practitioner or your gynecologist could address.
And we focus a lot on women's health, which is great because women's health, I think, was really not discussed for so long. But I also feel as if hormones for men are not discussed at all, other than the blue pill or the injection. And they kind of make light of it and they joke about it for men, but it's really important.
Yes, 100%. So one of the myths versus facts that I wanted to bring up is that with men, there's a myth out there that testosterone replacement therapy can cause prostate cancer, and this is incorrect. There's no significant link between TRT and prostate cancer when managed by a physician. Of course, you have to have your proper screening test, your PSA when you're over a certain age, and your proper prostate exam, but that is a myth, and men and also females should know that.
Now, will testosterone replacement therapy, TRT, help with ED?
Yes, that will help with ED and will also help with retaining muscle mass. And as you know, my theory above all is retaining muscle mass, keep moving, exercising, because muscle equals longevity.
Which is important for men and women. So when we talk about that, different modalities of getting the hormones, pellets, creams, injectables, troches, patches, there's so many. Do you find one go-to, or do you look at each patient based on their lifestyle and what's better?
So that's a really good question. I do look at each patient and based on their lifestyle, what will suit them. With pellets, sometimes you can't adjust the dose, and again, you'll have the rise when the pellet's inserted and then the decrease and drop of the level of hormones. So for a patient that is going to be compliant with either their pill, their patch, or their cream, a steady, even dose is given that way when you're using hormone cream that way. Same thing with an injection for men for testosterone. A gel will give you an even dose, whereas an injection is going to give you that rise initially and then that drop. So I like to do it individually per patient.
How do you determine which say men, maybe they want the pellets and they don't want to inject, they can use cream like women do as a bioidentical for men also?
Excuse me. Yes, actually, there's testosterone cream that is available for men. We've been using it for many, many years, even in the area of with HIV patients and lipodystrophy. There've been a lot of, publication through pharmaceutical agencies of using the topical creams and gels for men.
There's so many different kinds, and I don't think you realize, our public may not realize, how many different ways that we can replace the hormones.
That's right.
I know some women don't want to see the patch. To me, if it's going to make me feel better, you can look at my patch all day long. There's the cream. Some last longer, I guess, based on your absorption, your skin levels, your blood.
That's right.
Everything changes per person.
That's right. So there's a certain percentage of people that are non-absorbers. So in that case, we could use a patch as opposed to a topical cream or an oral estradiol. Now, there is more risk sometimes when taking oral medication with topical, but we take that into account.
What about joint pain, muscle aches? Would that be another symptom of maybe hormones are a little bit off?
Completely. So I think of it as like hormones help with the lubrication of the joints. So I know for me personally, I'm very active. I do, exercise at least 5 days a week. And I know without my hormones, I had a lot more joint pain and muscle ache.
How interesting, because think how many patients go to different doctors. You go to your orthopedist, you go to the cardiologist, and you're seeking to find relief from your joints, from your muscles, from even getting injured, playing pickleball or whatever we're doing. Mm-hmm. Recovery, if our bones and muscles are stronger and more pliable, maybe our recovery is easier?
1,000%, absolutely.
So hormones are really the first step maybe of what we should be looking at.
I definitely think they've been overlooked for many years, and I would put it on my list of what medicines are you taking over the counter, and also have you ever been on hormones or consider them?
So what is your intake process like when people want to reach out to you? Because you do telehealth, right? They don't
Correct.
need to come to you.
Well, right now I'm doing telehealth, so people can go online, book an appointment, and then I speak to them over the phone or through a telehealth system, and I take a full history, including, past medical history, surgical history, allergies, meds, etc. And then, we come up with a treatment plan that would be appropriate for them. We can also order blood work. They can provide the blood work if they have it already, or I send them a lab slip and they can have blood work done, and then I review the results and discuss it with them.
A lot of options.
A lot of options.
Which means you don't have to schedule an appointment. But I also want to talk about hormone replacement, private pay.
Yes.
Right? It's not covered by Medicare.
So most compound hormone replacement medication is not covered by Medicare. However, people can use their HSA card. And often, sometimes we can get some of it covered under their insurance if they're using a patch or a pill. So it varies depending on what insurance they have.
But there's a lot of options, and people can say, I can't afford it. Just make the phone call, have the first conversation with Dr. Amy and say, maybe this is for me. Maybe it's not, but maybe you could feel better or your spouse could feel better. Not just for sexual reasons, but just for overall better health. And bone density is so important. If you can prevent breaks when you fall, then your quality of life and healing becomes so much easier as well.
Right, and that's a really good point. Everything's integrated. If you're taking your hormones, you're eating properly, you're exercising, you're going to retain muscle, and by having muscle, we're preventing sarcopenia, which is muscle loss, and we're going to have less falls and less risk for fractures, which leads to debilitation.
So many people I've
decline.
spoken to, I don't know why, they feel like, I broke a rib. I was putting my grandchild in the crib, or I felt funny from the chair and I went to reach for a piece of paper. Because sometimes your bones become so compromised, you don't even realize it until one slight little move.
That's right.
You're in pain.
That's right. And I've seen that a number of times working. I've also worked in the urgent care and emergency room as well. And I've seen that.
And I think another big important thing is your why. Why call Dr. Amy? Is it because you want to feel better? Is it because you want to play with your grandkids? Is it because you want to go on a vacation and go hiking or just walk and not be in pain? Maybe if people find their whys in their lifestyle, our lifestyles now with this generation are much more active, I think, especially in South Florida.
That's right.
And when you were out in Colorado, another
Yep.
active lifestyle area.
Yeah. Yeah, and people are living longer, and what good is living longer if we're not healthier and we can't enjoy how we feel and enjoy doing the activities we love?
So important, and you are big on movement. So let's talk about
Yes.
some safe movements for people of all different ages.
So I recommend actually, and I do this with my geriatric patients, just simple movement, sitting in a chair, doing some ankle rolls, wrist rolls, shoulder rolls, and then leg lifts, and you can do chair exercises. So I had a aunt in California, and she was teaching chair exercises at 80 years old. Kudos to you for that. So my prescription that I want to leave you with for today is movement. Movement, retaining muscle equals longevity.
Movement of any kind, right? Getting up in the morning and just lubricating your joints.
Yes.
I've been looking at all kinds of different things. I was trying Tai Chi flow for movement. But sometimes when we wake up, our necks are stiff, and you just got to move. When you sit and just have a cup of coffee and you think you're going to work through it, You really just got to move.
That's right.
Little
Movement.
movements. Even walking, I
That's
see,
right.
as tremendous for health benefits.
Right, and it's going to be different for every person. So I recommend my patients to pick goals that are appropriate for them and realistic for them as well. So don't try to overshoot and look at what the other person's doing. Do what's appropriate for you. You know, if you can't walk outside, it's too hot, go walk in the mall. If pickleball is too rapid movement for you, pick something slow like a yoga or a Pilates. So pick what's appropriate for you.
What's your go-to?
My go-to is I love Pilates on the reformer. That's my muscle. I love dance. You know, I'm a big Zumba dancer, and I've been dancing my whole life. And then I also do a little bit of yoga, but my favorite is horseback riding.
I hear horseback riding is a big for you.
Yes, you don't realize it, but you use your core, you strengthen your back muscles, you're balancing, you're outside, beautiful nature, relaxing your mind. So a lot of benefits.
And horses are very healing and very therapeutic.
They are. They're very healing, very therapeutic, and they actually have a very, very large heart, so they give off a huge electromagnetic field, which can be healing. So we've also I've participated in horse therapy as well, equine therapy, which is amazing.
I know they have equine therapy for kids. I would think they must have it for seniors as well.
They do, actually. Yep.
Wow, that would be kind of cool
Yeah,
to even
so-
broach into that and meet someone, because especially if you've lost your spouse or you feel lonely, to get out and really do something different that you've never done. It doesn't even mean you have to get on the horse, right? It's just
No,
caring
in
for
fact-
the horse.
Exactly. You're not even, most of the times equine therapy, you're not on the horse. You're next to the horse. You're bonding with the horse. So it can be very fulfilling.
So many great
Yeah.
aspects. It has been such a pleasure. All right, before we wrap up, one fun fact about you.
Fun fact about me?
Fun fact.
I can ride my horse, bareback, Western, English, jump, and do whatever you want on my horse. Even dance on my horse a little bit.
Impressive. Amazing. And what's the best way for people to reach out to you?
Best way to reach us is through our email or my webpage, drseinfeld.com, or support@ginspirehealth.com, or my phone number, which is posted.
And all telehealth right now, so anyone, anywhere can get in touch with Dr. Amy Seinfeld. So give her a call, check her website, Dr. Seinfeld, SEINFELD.com. Dr. Amy, thank you so much for joining us.
Thank you for having me.
Happy Thursday, everyone. To All County Healthcare, thank you again for the opportunity. For more information, you can contact them at 954-717-7027 or allcountyhealthcare.com. Have a great evening, everyone, and I will see you next week.